The man collapsed in the crowded hospital lobby wearing worn-out clothes, clutching his chest as people quietly whispered that he probably couldn't afford treatment. Some looked away. Others assumed he was exaggerating. But one nurse ignored the rumors, rushed to his side, and fought to save a stranger she believed everyone else had already judged. By sunset, the entire hospital would discover that the uninsured patient was actually one of the wealthiest CEOs in the country, and that the greatest lesson of the day had nothing to do with money. If you believe in kindness, forgiveness, hope, and second chances, please like this video, leave a meaningful comment, share it with someone who needs hope today, and subscribe to our channel. Every bit of support helps our community continue sharing emotional stories that remind us compassion can change lives. Gideon Mercer had spent 2 decades building one of the largest private healthcare companies in North America. His hospitals were praised for modern technology, luxurious facilities, and impressive financial growth. Investors applauded him as a visionary, but Gideon had begun to wonder whether the glowing reports he received reflected reality. Anonymous letters from former patients described long waiting times, people feeling ignored because they lacked insurance, and staff overwhelmed by impossible workloads. Instead of dismissing the complaints, Gideon made a decision no board member knew about. On a bright Monday morning, dressed in faded jeans, an old jacket, and inexpensive shoes, he entered one of his own hospitals carrying only a small backpack. He intentionally left behind his wallet, business cards, and every clue revealing his identity. His goal was simple. Experience the hospital exactly as an ordinary uninsured patient would. At first everything seemed manageable. Receptionists remained polite but noticeably hurried. Paperwork appeared endless. Patients with premium insurance were quietly escorted into faster lines while others waited anxiously. Gideon carefully observed every detail without revealing who he really was. Then something unexpected happened. The pressure he had been ignoring for weeks suddenly exploded into severe chest pain. His breathing became difficult. Before he could ask for help, he collapsed near the waiting area. Several people rushed closer, but uncertainty quickly replaced urgency. Someone quietly mentioned that uninsured patients often exaggerated symptoms to receive faster treatment. Others assumed he was simply exhausted or seeking attention. Only one person reacted without hesitation. Her name was Maren Caldwell. She had worked as an emergency nurse for nearly 12 years and believed every patient deserved the same respect regardless of appearance, income, or insurance status. Ignoring the whispers around her, Maren immediately checked Gideon's pulse, called for emergency equipment, and demanded a treatment room without waiting for financial information. Some staff questioned whether hospital policy required insurance verification first. Maren answered with calm determination that a human life always came before paperwork. Her confidence silenced the room. Doctors soon discovered Gideon was experiencing a dangerous cardiac episode triggered by stress and exhaustion. Fortunately, Maren's quick actions prevented permanent damage. As Gideon recovered during the afternoon, he quietly listened to conversations outside his room. He heard nurses struggling with understaffing. He heard receptionists apologizing to frustrated families. He heard administrators discussing revenue targets while exhausted employees skipped lunch breaks. For the first time since founding the company, Gideon wasn't listening as a CEO. He was listening as a patient. And the experience broke his heart. When doctors finally declared him stable, Gideon asked to meet the hospital director privately. Minutes later, confusion spread throughout the executive offices. The unknown patient removed a small identification card hidden inside his backpack. The director's face turned pale. Standing before him was the owner of the entire healthcare network. Word spread through the hospital faster than anyone imagined. Employees worried about losing their jobs. Managers feared investigations. Maren quietly continued caring for other patients, believing none of it mattered as much as the people still waiting for treatment. Later that afternoon, Gideon requested a meeting with every department. Many expected anger. Instead, they witnessed humility. Gideon admitted that he had built remarkable buildings but had slowly lost sight of the people inside them. Reports had shown numbers, profits, and efficiency, yet none had revealed the emotional cost carried by patients and frontline workers every single day. He publicly thanked Marin for reminding him why he had entered healthcare in the first place. Then he announced sweeping changes. Emergency care would never again wait for financial verification. Additional nurses would be hired immediately. Mental health support would become available for every employee. Executive leaders would spend one full day each month anonymously observing hospital operations instead of relying solely on reports. Most importantly, every patient would be treated with equal dignity regardless of financial status. Some investors criticized the increased expenses. Gideon listened respectfully. Then he replied that healthcare could never measure success by profits alone. Months passed. Patient satisfaction reached record highs. Employee turnover dropped dramatically. Doctors reported lower stress levels. Families who once feared entering the hospital now recommended it to friends because they felt seen rather than judged. One sunny afternoon, Gideon returned to the emergency department carrying nothing more than a small basket of homemade cookies prepared by his elderly aunt. He found Marin comforting an anxious little boy awaiting stitches. She smiled warmly, unaware he had been watching. Gideon thanked her once again, not because she had saved the life of a CEO, but because she would have shown exactly the same compassion to anyone lying on that hospital floor. That, he realized, was true greatness. Years later, whenever young executives asked Gideon the secret behind building a respected healthcare organization, he never spoke first about technology, expansion, or profits. He told them about a nurse who refused to judge a stranger by his clothes. He explained that leadership begins the moment titles disappear and humanity remains. Every hospital in his company eventually displayed a simple message near its entrance. Every person who walks through these doors deserves dignity before documentation. Employees often smiled when reading it. Patients quietly felt safer. And Gideon never again forgot the day he learned the most valuable lesson of his career while wearing the cheapest clothes he owned. Before this story ends, we'd love to hear from you. Leave a meaningful comment and tell us, have you ever experienced kindness from someone who chose compassion instead of making assumptions about you? If this story touched your heart, please like this video, leave a meaningful comment, share it with someone who needs hope today, and subscribe to our channel so you never miss another emotional journey. Remember, the strongest hearts aren't measured by wealth or status, they're measured by how gently they care for people who have nothing to offer in return. Compassion costs nothing, yet it can save everything.